All right. So for this first question, I want you to work through this question how you normally do, and then we'll kind of compare and contrast of what I want you to do. All right.
Well, let me see.
So I want you to read out loud how you would read this in your head, and then I'll highlight as you read.
Okay, so normally I would start with the main question and I just say, which of the following is the most likely cause of this patient's bleeding symptoms? And then I would look at the choices to kind of just see.
Mm-hmm.
Okay. And then, okay, a 6-year-old boy presents to the clinic with a history of epistaxis, gum bleeding, easy bruising, laboratory findings of the platelet count, uh, PT. Do you want me to, are you highlighting only what I say out loud, or you want me to read the whole thing?
Yeah, I want you to kind of read the whole thing. I'm kind of listening to your train of thought right now. That's how I usually do this, and I'm going to highlight things that so that you can kind of mimic of what I'm highlighting. Does it make sense?
Yeah, yeah. Okay, so anyway, so the gum bleeding, easy bruising, okay, and then normal platelet, normal PT, normal PTT, okay, so I'm thinking more of like a platelet thing. So the platelet aggregation I should decreased aggregation of ADP and collagen, but normal aggregation of ro which I think is von Willebrand. Let me see. So aggregation collagen decrease, which is no cause. Okay, so let me think. So now I don't think it's von Willebrand.
Okay.
Um, decrease of the
So work me through your thought process. I'm in a sense, right? The silence to me means that you're thinking a lot. So what's going through your mind? So that remember the whole idea here is that I want to hear your thought process so that we can kind of figure out, okay, so what are you thinking? How do I direct you? Things like that.
Yeah. And just to, so is this recording for like, we'll go on the YouTube?
Yep, but it's all just your voice. No one's gonna know like your name or anything like that.
So kind of where um I'm at is I know it's a platelet issue.
Okay, good.
So I
Good.
it's not like a coagulation factor problem because those are all normal. And
Okay,
then
good.
with the ristosittin, I believe that that's von Willebrand test.
Okay.
And so I'm because I'm trying to remember there's two. Yeah, I think that's von Willebrand. So because of that, then if I'm saying that that's for von, it can't be factor 8 deficiency. So I'd probably get rid of that. Vitamin K deficiency, get rid of that because
Okay.
that's again and then I'd be between Glasman and Bernard. And
Okay.
Glasman's a problem with GP233A, and then I think Bernard's a problem with uh, GP1.
Okay, good. I'm liking where you're taking this. Okay.
And when I think of ADP, I'm thinking of like the G2P3.
Okay.
But when I see collagen, though, it makes me think of like Factor 1 and Bernard Sawyer. So then so I'm looking at both ADP and collagen and thinking of two different answers. But
Okay, so
uh,
let's break this down a little bit. Okay, so I'm gonna tell you what I'm thinking. Okay, and then you kind of compare contrast, right? So I'm reading the question just like you are. Which of the following is most likely cause the patient's bleeding symptoms? And you read this, you know it's a hemonc question, right? And then you go 6-year-old boy, so that you know that it's a pediatric patient in clinic with recurrent epistaxis, gum bleeding, easily bruising, right? So bleeding disorder, boy, that's 6 years old, so it's pediatric. Laboratory findings shows a normal platelet count, normal PT, normal PTT, right? So in my mind, right, it can't be a factor issue because PT and PTT are normal. It can't be a thrombocytopenia because there's normal platelets, okay? And then you do a platelet aggregation, meaning, right, there's two things with platelets that you need to form clotting: adhesion and aggregation, right? So it says platelet aggregation studies reveals decreased aggregation with ADP and collagen, but normal aggregation with resistocin. Which of the following most likely cause of this patient's bleeding symptom? So I know that it's not a factor, so that gets rid of a lot of things, right? That gets rid of vitamin K, that gets rid of factor 8, and also gets rid of von Willebrand because usually that has a increase PTT, right? Because of the factor 8 that it kind of interacts with, right? So your PTT will be elevated. So then you got Bernard-Soley syndrome and Glasman thrombasthenia, right? Which I can never say, right? So now we're between the 50-50 that a lot of people get between, which I think you're great, right? So now the question is, which one deals with aggregation? Which one deals with adhesion?
Right. So when you just from saying it from that angle, since we're dealing with aggregation, I think it's Glassman. Um,
Okay, does that make sense?
yeah. See, I got honed in on ADP and collagen, and
Yep.
versus, and then I took an extra step to like verify, but then yeah, and then when you rearrange that, then I was able to find it. Yeah.
Yeah. So my thing here is that you want to look at things as a whole, right? So the reason why one of the main things or pitfalls is that when you look for specific words, aka buzzwords, aka keywords, right? You're gonna get stuck on, oh, I remember that Bernard-Soler syndrome deals with what? Oh, that deals with something with collagen, right? Oh, but then when you say, oh, you look at it and you're like, oh, this is an aggregation issue, right? As a whole, then you know it has to be Glasman's, not Bernard-Soler syndrome.
Mhm.
Okay.